Hey folks, it's Coco One Love. We're talking about the knee position in the squatting movement this time. We've already addressed the foot, so I want to address the knee a little bit more in depth. So basically, a stable knee position in a squat is either in neutral or externally rotated. Okay, I prefer the externally rotated position because, like we said, in the squat, it ends up generating more stability and more torque in the hip. But also the reason why I like it is because it allows the knee room to move back to neutral in case the knee is searching for some kind of stability, or you just need to strengthen that area a little bit more in that movement. When you squat in neutral, what ends up happening is if the knee starts to search for stability, it ends up kind of collapsing in. And that's exactly what I want to specify in this video, is that we do not in any way want to see the knee coming in during a squatting movement. If you see that that's happening during your squat, you need to stop squatting. You need to figure out how you're going to correct that. So how would I work on correcting that? So we're going to go back to the foot. Is your foot straight or is it turned out? When our foot is turned out, our arch collapses, and therefore our knee is going to collapse in as well, and that's going to cause injury. We never want injury. So make sure that our foot is pointing straight. Okay? Next, we're going to talk about, are we understanding the proper sequencing of the squat? Are we loading the right joints first? Are we loading the right muscles first? So on and so forth. So we go back to the video that's called Squat, and we'll review that and review the sequencing and see if we're going through the proper sequencing during the squat. Once we understand the sequencing, do we have the motor control that it takes to go through that movement and actually ask our knee to drive out or stay neutral and not collapse in? Do we have the sensory awareness, the connection to do that? So we need to test that. Now, if we go through all that and that fails, we need to kind of retrack and say, oh, okay, well, maybe it's a mobility issue. So I need to go back into my mobility tools. I need to go back into my mobility series, backtrack on my channel and watch all the mobility series. And I need to work on mobility and see where I have missing range of motion, where I have limitation, and kind of correct all those tissues and see if that addition of range of motion is helping me stay out of that faulty position, knee in. Knee in is a no, okay? If I go through the mobility and I find that, oh my God, it's still kind of occurring, my knee is still caving in. So then what I need to do is I'm saying, oh, okay, well, I have the motor control and I have the mobility, so I have the range of motion. What's left? What's left is the stability of the knee, the stability of the joint. So I need to go back and work on the stability issue, and that would be you going back into my symmetry series and working on some of those movements, and in particular the chop and the lift, and basically trying to maintain a nice stable knee position, all joints aligned, and keeping that knee in the position that you want it while you're going through that motion. Work on those symmetry movements, and then come back to the squat and test the squat again. And that should be, if you've gone through all those, you should be at the point where you've pretty much gone through the checklist and your knee is able to stabilize, has the range of motion, and you have the motor control to keep your knee either in neutral or externally rotated. Okay? But knee never in, folks. I never want to see this. Okay? Never want to see this one knee. I never want to see this. When we're squatting, we want to see a stable knee, either neutral or externally rotated, but we never want to see this happening. And this is not only in the squatting, this is also in the running, and this is also in the jumping. We'll see it a lot in jumping as well, and walking. Okay, so we always want to protect the knee straight or externally rotated, never collapsing in. Coco One Love, protect yourself, safety first, understand the mechanics of the body, keep it nice and mobile, and keep it stable. Go through life with no injury, no pain, and always ready for action, ready for spontaneous occurrences, always ready to perform on an optimal level. Much love, Coco One Love, do good. I think you should subscribe and share us, please. We love you. Much love. Peace out.